So we're talking about Gleason score, and so some of you may have what's called a Gleason grade 7 prostate cancer, and a Gleason grade 7 is it's more aggressive than the Gleason 6. The Gleason 6 it's lower risk prostate cancer, and it's often something that is watched with what's called active surveillance. Oftentimes. But a Gleason 7 is just something that's just more aggressive than the Gleason 6. It's something that's potentially more invasive nature. It's also a cancer that can spread. And so when you have a Gleason 7, it's important to know which type of Gleason 7 you have, because your treatment will often be different based on where you are with this Gleason 7. So there is what's called a 3+4. And there is what's called a 4+3. Both Gleason 7, but this 4+3 shows more of the biopsy tissue is aggressive than it is this more non-invasive type. So I hope that makes sense. So more of it is aggressive on a 4+3. And so this, because of this being more 4 than 3, this makes this tumor unfavorable. Whereas this is called favorable. And so when you look at treatment for favorable cancers and unfavorable cancers that are Gleason 7, sometimes this can mean something as simple as just adding hormone treatment, or what's called ADT, androgen deprivation treatment. Sometimes this patient will receive androgen deprivation anywhere from 4 months to a year in combination with traditional radiation treatment and things like that. So, someone with a higher grade tumor, the length of time that they would be on this ADT is oftentimes longer than someone that has a Gleason grade 7. These 3+4 patients, they can have treatments that are often just, sometimes monotherapy treatments are available for these 3+4 patients. So sometimes you're looking at like for me personally, if I had a 3+4, in certain situations, I would consider proton beam. I would consider focal therapy. I would consider some of those, because the disease is less aggressive than this unfavorable one. So that's it. That's Gleason 7. It's the first step, because a lot of these Gleason 6 patients are watched nowadays. 20 years ago, 15, 20 years ago, most of these Gleason 6 patients, they were treated actively with surgery or radiation, things like that. Now, because we know more about the tumor, we know more about how to monitor them with blood test PSA, with imaging and MRI and repeat biopsy. We know that a lot of these Gleason 6s are not going to progress and need active treatment. So it's just a step up from this lower grade cancer. And again, it splits into two, and it's delineated as favorable for a 3+4 and an unfavorable for a 4+3. These unfavorable patients may get some additional treatment. that someone that has favorable pathology wouldn't. So it's just important to know. I hope that was helpful. I hope these videos are simple. What I'm trying to do with these videos is just make it simple. Prostate cancer can be very complex. Complex for the patient, complex for the family. It's even complex for doctors. I mean, there's just a lot to prostate cancer. So if this was helpful, please hit like. And if you know someone with prostate cancer, know someone with a Gleason 7 prostate cancer, hit share. Share this with them. See what they say. See if it was helpful. And if there's a question I can answer specifically regarding prostate cancer and treatment of prostate cancer, please hit it in the comments, and I'll try to address it in a future video. So thanks for watching. I'm Dr. William Stiles on urologyanswers.com.